Hi, Ed.
Hey, hey, how are you?
Good. How are you doing?
I've been doing great. I'm very thankful.
I'm so thankful that you joined me today so that I can introduce you to my other friends and we can all just do some togethering around this COVID crisis and what it means to us and to you. So, this is Ed Edris. And Ed, would you tell us a little bit about yourself?
Yes, I'm an old friend of Elizabeth's. It's been a few years because we've traveled different pathways. I've gone to medical school. I'm currently in my second year of specialty training in West Virginia. And so I am a physician and a new physician, but I'm still a licensed physician. I'm glad to catch up with Elizabeth, and it's been great to be invited to be part of her together. I'm currently under quarantine because when this disaster started up, I was actually at a medical conference in Colorado. And the conference, made some adjustments on the fly as the news came in. We did social distancing and so forth. But when I returned to West Virginia, I had to go under quarantine because I was potentially exposed. And wouldn't you know, several days in, I started a low fever. So I had to get tested. And that was last Monday. And as of today, my test results still haven't come back.
Oh,
But
wow, Ed. It took me about 11 days for the results of my second test to come in, which
wow,
were negative. But yeah, it the labs are just all backed up.
they are. My colleagues that were also tested that were at the convention with me, they all came back negative. We all had similar symptoms, which were not respiratory symptoms, but more gastrointestinal symptoms. And so they weren't real severe, just miserable, and we were fine. And
But
I'm
still, as a doctor, you don't want to go
right.
into your office and start seeing patients.
And that's true. And that's another big reason that I've been sitting in my house, doing my best not to go outside more than I have to, because I don't want to infect other people. In my specialty, I do manipulation, osteopathic manipulation on my patients. And so that's really hands on direct contact. And what my clinic did is actually they canceled all of my appointments for the next several weeks because it's not worth the risk of people coming in and being exposed to infection as opposed to living a couple more weeks with their back pain and so forth.
That's just smart.
Yeah, no, that's great. That's the best prevention we have is limit all exposure. It's interesting, when I got tested, it was at the clinic I work at. They swabbed me in my car in the parking lot.
They did because you had to go through the procedure.
I had to go through the procedure. I think my nurse enjoyed it. She was all dressed up. It was my
That counts.
nurse. Yeah.
Yeah.
So paybacks are fun.
You're in West Virginia. What are the restrictions on movement for most people who are outside of quarantine?
So the governor has been making updates almost daily. The most recent ones that I read today, I think, decreed that we should discontinue all non-essential medical procedures. And they defined that as anything that will not cause death or permanent harm within the next 24 to 30 hours. And
Okay.
so that's really restrictive. We're allowed to call patients on the telephone, but yeah, we're shutting down just about every other non-essential procedure. People are to limit their public activities to only what's essential, the grocery store, and again, go at specific times, stay away from people, and keep your social distancing 6 feet or more wherever you're at. So it's
Okay.
pretty much the same as everywhere else. The newest thing I saw is, again, this is common across a lot of states. Apparently, someone thought people were trying to escape to Appalachia to get away from the virus. And the governor said, please don't come to West Virginia.
That's interesting because West Virginia was the last state to have.
It was the last state. And we actually joked on our way home from the conference that we as physicians could be patient zero bringing the virus here.
Yeah.
Fortunately, that wasn't true. Here in the Greenbrier Valley, where I'm at, about 3 days ago, we had our first patient in our hospital that tested positive. So we're really behind the times. But what that means is we have the time to learn from other people's mistakes and we have time to prepare. Our hospital is doing a great job. The leadership are counting our protection supplies every day, keeping a strict inventory, getting as many in as we can. They're working with the local schools, which are closed. The schools all closed with the exception of delivering lunches to school children. Because of the poverty here, most children get their meals at school. But since the schools are empty, they're using their 3D printers to make face masks for the N95 masks.
That's incredible. That
Yeah,
is
they have these plastic masks. Unofficial testing at our facility, you can mold them, heat them with a hairdryer, mold them specifically to your face. You can sanitize them as often as you want. They're pretty much indestructible, and all you have to change is the filter, which they were using a makeup pad for a filter in the model that they made here.
That's incredible. I
So,
mean, yes, the ways that the people are becoming innovative. But you're right, you are going to be able to learn. And hopefully you won't have the supply strains when you hit your peak in your state. You know, I spent 7 years of my life on a mountaintop in West Virginia. So I have my ideas. But why do you think that West Virginia was one of the last states?
I attribute it to the geography. Anyone who's been to West Virginia knows that it is straight up mountains with very few spots that aren't a hillside. And so it really makes social distancing a natural thing that happens in everyday life. The other thing is the poverty rate is pretty high, and so the people don't have the means to travel. You don't have a lot of local people coming back from tourist spots and international travel. And so West Virginia is naturally isolated. And I don't know if you agree with that.
I do agree with that. I'm thinking of the mile-long lane I had to traverse to get to my isolated spot. It's
Yeah,
a beautiful place, and hopefully some of that isolation will mean that, well, isolation and the good practices that you have a chance to put in place will keep your numbers low. I hope.
yeah. We're hoping for that. We're doing our best. Again, the bottleneck is the screening. And like I just told you, it's been about 10 days since I had my test collected. I don't know if it was lost. The other reason that West Virginia is behind the curve is because of the testing, and it just wasn't available in West Virginia until recently. I was reading about the first case that was confirmed. They had to call so many numbers to get in touch with somebody to even find a test, and then the test was misplaced, and it was just delayed. So that was positive 10 days after it was collected.
Mm.
And so we didn't know that we had a positive case within West Virginia because the testing was so delayed.
There are a lot of growing pains, bumps with getting this whole thing underway.
I think so many people have mixed emotions about everything that's going on right now.
Mhm.
These are brand new stories.
I imagine you're still in touch with your colleagues and things like
Yes,
that.
yes. We're texting not only my colleagues here in West Virginia, but medical school classmates in California. There's a gentleman that was in this program that transferred to New York, so we got firsthand accounts from there. And it's serious. When someone is describing how they are losing 100% of their patients, it really hits you hard.
Is it 100%, Ed?
She told me that in her ICU, and our patients only go to the ICU if they need a ventilator, but she said 100% of them died. This was in California. She said that they were actually contemplating to not try resuscitating these patients anymore because it was so futile. And, with CPR, there's aerosolization, which puts the healthcare providers at risk. And so it's really hard to just walk away. Yeah,
Yeah, the emotional impact on doctors and nurses has to be incredible right now.
it
Caregivers.
is.
I heard someone say that they expect a lot of post-traumatic stress syndrome within the medical community after this is over, but somehow I think that there's a good chance it's already starting to
No, some people say that's what you signed up for. It's true.
happen.
But
But you're still
when
people.
it's real, it's real.
I
We
mean,
are.
that you're still people with emotions and caring and compassion. It's probably some of that caring and compassion that made people sign up for those caregiver kind of jobs, right?
Exactly.
And study for it. So, well, my heart really goes out to you, and it really is a sacrifice to be able to do that. Wow. So, how do you cope?
Coping. Coping with what? There's so many things to cope with.
Well, how do you cope with these stories, first of all?
That's a difficult thing to put words to. obviously, like I said, we signed up for this and you have to cope. And so our coping strategies have been in place for a long time. It's fresh every time, but you learn to accept reality. You learn to reassure yourself that we did everything we could. We're doing the best we can with what we have. And if you know you couldn't have done better, you have to lay that to rest and not carry any guilt with it. I guess what makes a good doctor is caring for your patients, right? And that's a double-edged sword because if you care, it hurts.
I bet he does. Well, when you said you have to know that you did the best you could, I'm just thinking of a verse that I painted and put on my wall a long time ago. And that's when Jesus said, she has done what she could. And, we can make the she be a non-gender term right now and just accept the fact that we do what we can.
Right. And I think that's part of what helps me to deal with my quarantine. I'm doing what I can. I would love to be in the hospital helping out with extra shifts, which is what they're asking us to do when things get more severe here. And hopefully by that time I'll be up and going. But until my test results come back, I'm doing what I can. I'm sitting at home. It's tempting to go grocery shopping just because you want an excuse. It seems like a good excuse. Truth is, I still have eggs and milk. I don't need to go grocery shopping. And so I stay home.
I've said this before, but I want to say it again because it's such an important thing that all of us can do that. We don't need the special medical training. We don't need to do anything except stay home and watch Netflix. And we can all be heroes that way. And I don't think people get that enough. Ed, you and I share a common cohort of acquaintances in the conservative Mennonite and Amish communities in Lancaster County. And speaking of staying at home and social distancing and things like that, I have heard way too many stories of people in those communities and other Christian communities who are gathering, meeting for church, getting together for hymn sings, and just hanging out together.
Yes.
That troubles me.
Yes, I think I can speak to that. And just to back up, one of your previous statements was to stay home and watch Netflix. A lot of these people don't watch Netflix, but I want to do a little tangent right now. Coping. Staying at home, even watching Netflix, some people watch television. My roommate likes to have it on for background noise, and we've had to make a change because too much of a bad thing is a bad thing, I'm told. I totally agree with that. And the news is incessant, and it's discouraging, and it makes things feel almost impossible. And so what we did instead, we turned the news off and we turned music on. You have to limit the bad things in your life, including the news. It's real, but you don't need to hear it 25 times a day. You need to get on with your life. The communities that we were talking about, I want to be very kind. I do understand these often tend to be more rural communities, outdoors type people that they feel isolated from the big news. They don't live in the cities. They're not hearing the sirens, seeing the lines of people. They may have experienced a little bit of empty shelves in the grocery store, and that's interesting to them, but it's not as traumatic to them. And I think they feel that this does not apply to them. Here in West Virginia, if it's 2 hollers away, it don't pertain to me, right? And I think that's how some people feel. If it's 2 farms away, it's not going to touch me. Concerning thing here is, and I think it's because they really don't understand, this is a brand new virus. We've never had one like this before. You can be infected for close to a week before the symptoms show up. And during that time, you can infect other people, like you were saying earlier. That was one of your concerns, is passing it on. Mm-hmm. Passing it on is actually a big deal. This isn't like chickenpox where you're miserable for a day or a week and then you move on. This is something that randomly selects people, and it's not just people that are ready to die anyway. There's young and middle-aged nurses are dead already from this virus, and they had no pre-existing conditions. So it attacks willy-nilly. You can't tell if you're going to get hit or not. Ultimately, you need to care because there's grandma and grandpa. They are extra vulnerable. There are people, for example, with disabled children who may not be able to tolerate vaccines and so forth. They have a little more of a fragile immune system. And so those are the people that are going to be affected. Even if they survive, going to the hospital, being on a ventilator is traumatic. You wouldn't want to wish that on anyone. And so it's been difficult for me to just listen to some of these. When I say listen, obviously it's posts on Facebook, things like that. The conversations that are happening, there's a few people giving out really good opinions and addressing this, and I can't name them right now, but they've done a really good job at expressing why we need to do what we can by staying home, because that is truly loving our neighbor and what the Christian faith would require of us.
And that's a really good point. I hope that some of our friends within those communities are going to hear your words, because I care about them. Well, what hope can we take in the middle of all of this?
Hope. Hope is a good thing. I would say our hope is that with dialogue like this, with communication, and again, back to our friends that we were referring to, I think if they hear from trusted sources, people they know, that this is actually real and serious, perhaps, they will be able to do their social distancing in time to be effective. Hopefully they will respect. The governor is pleased to not have large congregational gatherings, church services, and so forth. This is not an attack on religious freedom. This is just a straight up godly concern for your personal safety. And no, Christians are not immune to this virus. There is reports, again, so much bad information out there. You don't know what's true and what's just sensational clickbait. But reports of choir practice where 40 people got infected because one person didn't know they had it. And so if the whole church is on ventilators, was it worth that one service? And so the hope is that we have enough information to learn, and we can act, we can do what we can, and the situation will be better for us.
And just accepting that the biggest act of love and kindness that we can offer each other right now is keeping our distance.
I was thinking earlier, I was trained in the stages of grief. You may have heard them before as well. And I think there's an element of grief to this situation. We're losing our freedom that we've had. We're losing our routine. We're losing things that are familiar to us. The stages of grief include disbelief. We're like, this can't be happening. It's not true. There's acceptance. There's bargaining. There's depression. There's anger. And so all of these things are normal to feel. I think we need to recognize them, acknowledge them, but just because you feel that way doesn't mean you need to act that way. And just recognize that this is a time of loss in some ways. Back to your other question, this can be a time of hope. And so if we focus on calling our friends and neighbors to make sure that they're okay, doing deeds of kindness for a family and those sorts of things, I think this can be a rich time where we find things about ourselves and our community that we didn't notice before, appreciate things, and when life becomes normal again, I think we're going to be more grateful.
And therefore, it won't be normal.
It won't be.
Let's hope it's a better normal.
Right. It's going to be a new normal. We're all going to be at least, 2 weeks older.
Exactly. And probably a lot different inside.
Right.
It hasn't hit us yet, this peak. And this part makes me shudder. It's very likely that we are going to, each one of us, know people who will either be very, very sick and will be hyper concerned about them, or that we will lose them.
We can always hope.
Yeah.
Now we know what we can do to maximize that opportunity. But I think you're right. We are all going to be wiser, hopefully, when this is over. I think one of the most uncomfortable things about this time is people are having to change their minds. The ways we were thinking yesterday don't work today because we have new information.
Are you talking just about the COVID virus, or are you talking about life in general?
How would you interpret it?
Well, when you said that we're having to change our minds, I was thinking we are changing our lives,
We
and we
are.
are looking at life differently in a way that I hope is changing our minds and our outlooks.
Right. One of the basic things that a lot of my friends are dealing with, what is a Christian to do when our routines, our spiritual routines have been interrupted? We have to modify how we think about fellowship, how we think about church, how we think about loving your neighbor. It's a little different concept than we typically think, to love your neighbor by staying home. So these are new thoughts, these are new ideas. Learning how to live without going to the grocery store, learning how to be at home with the whole family for days on end. There's lots of new things, new perspectives, how to deal with troubling news that leaks in through whatever channel you get your news, how to deal with the fact that not all the news is trustworthy, how to, you know, it goes on and on. We're having to evaluate our thoughts a lot more than we did yesterday.
And that can be a good thing. There can be good outcomes from that.
Right. That's a growing experience for us. And so it's forced on us, but I think in the end it's going to be useful. We're finding out who some of our friends are now that they're confronted with hardship. You know, they may react in different ways than what we've been familiar with. And so we need to change our thoughts and our feelings about them as well. And so it's a time of change.
I was talking to another friend about change, and not everybody is as agile and ready to accept change as other people. And some people are going to have a difficult time with that. How can we help those that are having difficult times?
I like your observation there. We don't all have the same flexibility. And I think this comes back to being extra loving to the people you meet, including being kind to them if they're not as flexible as you are, accepting that they haven't made the changes you have, being gracious to them if your viewpoints kind of clash on certain things. And so I think we just need to be conscious of our own attitudes. And when we come up with someone who has a different opinion, we need to take a moment and remember to be kind.
Ed, I'm really concerned about you. My hope is that you wouldn't have to go back to work.
Right.
On the other hand, I am so exceedingly grateful to people like you who've chosen to spend their lives helping people who become very ill, even at your own risk and peril. So my prayers are going to be with you. I really, really admire you for this. And to wrap this all up, I would like to take a moment of silence to think about the situation and reflect on some of the things we've talked about, including the specific needs that you've brought up. Togethering, because we will get through this better if we get through this together.
I agree.